Faiman, from what you've described, undergoing CAR T-cell therapy can be a very intense process. Why would someone consider this option over another myeloma treatment option?
Yeah, so the CAR T-cell therapies have really transformed myeloma, in my opinion. When we first started using CAR T-cell therapies, there was a long wait list because people who had had 3, 5, 7, 10, 12 prior therapies, they had very few other options. So we had to ethically assign scores to people as to who we'd get 1 or 2 slots a month, and then we'd have 80 some people on this list. And we're thinking, how do we allocate who's going to get this therapy? And it's because you can have a nice long remission off of all therapy. It's a great option for most people. Again, I would hope that we can get this moved further into the disease trajectory. There are actually 2 studies. One was the KarMMa study. It was published in the New England Journal of Medicine in 2023, early part of 2023. And it showed that when people get this therapy earlier, the ide-cel first, you can have a longer remission. So we're talking about 3, 4, 5 or more prior lines of therapy. You can get about 11 months with the ide-cel. You can even get a longer remission off of all therapy if we move it earlier. Same with cilta-cel. We had studies and different cohorts, and you can be in a long remission. So think of somebody who's, myeloma is incurable. It's very treatable, but it's incurable for most. And so you go from the expectation of staying on treatment until disease progression, much like other chronic conditions like diabetes. We don't stop medicine for diabetes or high blood pressure. And it's the same with myeloma and many of the cancers that we treat these days. And so a CAR T-cell therapy will give patients the option of having that disease-free interval where you can go and travel the world. I have patients that have bought RVs after their CAR T-cell therapy, and then now they're, going around the world, well, not the world, but around the United States.
The
country and just really enjoying life and taking that time off and being realistic, though, knowing that we have to do blood work every month to make sure the myeloma is still in remission, because it can come back, but at least it's sleeping for right now. So you can go out and enjoy your life and take those trips and enjoy the little things and the big things.